What exactly do you mean by insulin resistance?
It is like insensitive to insulin, not sensitive to. That's why body is producing sufficient or more insulin, but that insulin is not sufficient enough to bring down the blood sugar levels. That's why hyperglycemia and type 2 diabetes is produced. So in patients with type 2 diabetes, the patient may have low insulin levels or even high insulin levels, and still he is diabetic because of it, that present insulin is not working properly. In initial phases, most of the patients have high insulin levels, and later as the disease progresses, the pancreas and the beta cells in the pancreas, they get exhausted and they die off, stop producing it, and patient will go in continuous diabetes, and it will be not reverted back, or the patient may not go in remission.